Whitaker, and I am from Virginia Housing. For those of you who might be trying to identify me or may not be able to see me or you're just listening, I'm an African-American female. I'm wearing a green top and I have curly hair. I want to thank again the Disability Law Center of Virginia for hosting this program, and again, thank all of our other sponsors that made this event possible. Now, let's get started. As we said in the opening session, we have two very well-respected panelists who are experts on the topic. So let me now introduce you to them both. I will begin with introducing Dr. Kimberly Knackstedt.
Great.
Dr. Kimberly Noxton, while she stepped into her new role as of January of this year, according to Time article written about her appointment, Knackstedt has a long history with the disability community. She most recently served as a senior disability policy advisor on the Senate Health, Education, Labor, and Pensions, also known as HELP, committee. But she started her career as a special education teacher, where she saw the systemic barriers children face to accessing education. She then went on to get her PhD in special education and policy before working on Capitol Hill. Now she is in charge of tackling those structural barriers and ensuring equity for people with disabilities. From arguably the most powerful disabilities rights position in the country. We look forward to hearing more about her and also hearing more about visible inclusion of disability needs in federal policy making from Dr. Knackstedt. I will now introduce to you Dr. Janice Underwood. Dr. Underwood strongly believes in servant leadership and culturally relevant reform. She was appointed by Governor Ralph Northam as the Commonwealth of Virginia's first cabinet level Chief Diversity Officer, CDO. This position is also the first of its kind in the nation, and the Commonwealth CDO is committed to addressing racial, ethnic, disability, gender-based, and other cultural inequities in formal and informal places and practices in Virginia state government. As a result, Dr. Underwood is working tirelessly to build the One Virginia statewide strategic plan for inclusive excellence across all 100 state agencies. She most recently has been named one of the 20 Women of Change in 2020 by the Virginia Museum of History and Culture. And with that, we will begin our session with questions. And let me tell you, what we're going to do is we'll start questions with Dr. Knackstedt first, then we'll go to Dr. Underwood, then we will have questions in the chat. We won't be able to get to all of them, but we'll try. But before we get to the questions, we'll have Dr. Knackstedt start with opening comments and then Dr. Underwood.
Great. Thank you, Adrienne, for the introduction. And it's such an honor to be with you all today. And especially with Dr. Underwood. We had the pleasure of getting to know each other briefly yesterday, and I'm so excited to get to work together more in the future. So again, my name is Kim Knackstedt. I'm the Director of Disability Policy for the Domestic Policy Council. I use the pronouns she, her, and my visual description is that I am a white woman with short blonde hair, and today I'm wearing a black top with a tan blazer. I'm sitting at home today, avoiding the rain in front of my plants at home. I just wanted to note that if there is a chat feature that you can use, unfortunately, I cannot see it due to presidential records. And so I will lean on Adrienne and others during the Q&A time to help me facilitate questions. So I promise I'm not ignoring you if you are trying to chat me. So I want to take time today to talk through several key items and provide a little bit of framing around the goals of disability policy in the White House. I want to share about some of the president's key policy objectives and specifically discuss our work to advance diversity, equity, inclusion, and accessibility across the federal government. So to start with some framing around the Domestic Policy Council, The Domestic Policy Council, or often what we call DPC, is led by Ambassador Susan Rice, who has a fierce commitment to equity. Our role on DPC is to advise the president on policy across domestic issues. We accomplish this goal with 4 teams. We have a health and veterans team, economic mobility, immigration, and the team that I sit on, which is racial justice and equity. Our racial justice and equity team has individual policy portfolios for each person, but we also coordinate closely with our colleagues within the other teams to ensure equity is embedded in all of our policy development and action. And to really kind of build on that, the role of having a policy person within DPC focused on disability is brand new to this administration. Prior to me, disability was a focus of outreach, which it continues to be, but it wasn't integrated into our policy development in the same way. So my core goals in building out this portfolio has been and continues to be a focus on access, equity, and inclusion in all activities, policies, and actions of the administration. Taking an intersectional approach to policy development, we must think about the individual's whole self, such as race, sexual orientation and gender identity, and disability. And ensuring that disabled Americans are at the forefront of our policy development and deeply embedded into how we think and act when implementing our goals. I'm honored to be working for President Biden, who is working to advance policies that will support people with disabilities, recognizing that 31 years after the passage of the Americans with Disabilities Act, or ADA, we still have significant work to do to make our country inclusive and accessible for all Americans. It's hard to believe we've only been at this work for 9 months. Feels like a lot longer. But we kicked off the work with the American Rescue Plan. That was the first COVID funding package that actually had direct support to disabled Americans, despite all of the work in the previous year. As many of you may know, the American Rescue Plan provided billions in funding for educational supports for children with disabilities and billions in funding to states for Medicaid funding for home and community-based services for 1 year. This Medicaid funding will expand access to home and community-based services and ensure that caregivers are fairly compensated for their work. The president has an ambitious Build Back Better agenda, which will directly support people with disabilities of all ages in many ways. I want to highlight a few of those key areas. President Biden is calling for a high quality, accessible, and inclusive preschool for our 3 and 4-year-olds. Children with disabilities will specifically benefit from this, as access to preschool can be really challenging for children with disabilities if it is not inclusive and accessible. In addition, the Build Back Better agenda proposes significant investments in childcare, which will help families to access inclusive opportunities for children with disabilities. President Biden has also proposed more long-term investments in the caregiving economy, which again expands and builds on that American Rescue Plan investment. This investment will support well-paying caregiving jobs that allows for benefits and the ability to collectively bargain, and building the state infrastructure to improve the quality of services and supports to workers. So in addition to these legislative proposals, which we are very excited about, the president has advanced executive actions that move forward our work on equity to support underserved communities across the country and within the federal government. And so as I mentioned before, I want to take a moment to focus on one executive order in particular, how we are advancing diversity, equity, inclusion, and accessibility, or the DEIA executive order. This executive order takes an inward look at the federal government on how we are focusing on our federal workforce and how we are working to become a model employer. With the implementation of the DEIA executive order, we have established a robust interagency process to ensure we are delivering on the objectives of the executive order and executing on a government-wide strategic plan, as well as providing support to all of the various agencies. We are at work establishing a data-driven approach to advancing DEIA. This means understanding our demographic data and what the data tells us about practices that may lead to inequitable employment outcomes. We are working on the required government-wide strategic plan that sets forth standards of success for DEIA and identifying strategies to advance DEIA within the continuum of the federal employee's work. We're trying to shift away from a merely compliance framework and working to break down barriers, attitudes, and bias to create a culture of inclusivity across the federal workforce. From a disability lens, the EO takes significant steps to advance accessibility for employees and workers with disabilities in the federal government. We added the A to DEI, which stands for obviously accessibility, and defined accessibility for the first time. So you may often hear about D&I work or DEI work, but accessibility and defining was really critical. It not only focuses on physical and digital accessibility, but also breaking down barriers that are attitudinal. Workers with disabilities were embedded throughout the entire part of the employee's life cycle of recruitment, hiring, training, and development, thinking about support and compensation and advancement. Every step of the way in the development of the EO, workers with disabilities were included, which means taking an inclusive and accessible approach to the implementation, and that will be critical through the entire process. The key takeaway from kind of this brief overview is with our work is that nothing is happening in isolation. We have a through line of equity in all of our work with an intersectional lens. We have a lot of work we are getting done, from implementation of executive orders and ensuring every aspect of the Build Back Better agenda is accomplished. People with disabilities are included through each step as we think about advancing competitive integrated employment, addressing the caregiving needs and the caregiving crisis, focusing on educational equity, and doing what we can to reach health equity. And with that, I want to thank you for having me here today, and I'll hand it back over to Adrienne.
Thank you so much. At this time, we are going to ask Dr. Knackstedt some questions, but we will ask those questions after we hear from our other very esteemed speaker, which is Dr. Janice Underwood. Dr. Underwood? And I believe you're on.
I'm officially unmuted. That's the sort of story of our lives. Well, great morning. Thank you, Adrienne, for your earlier introduction. I want to express my deep felt gratitude to the Disability Law Center of Virginia and Virginia Housing for hosting this important summit and for inviting me to participate in such an important discussion. And I am truly honored to join Dr. Knackstedt on this plenary, another DEI champion. I want to share very quickly and center that I'm a Black woman who identifies with the pronouns she and her. Today I have on a light gray suit and my hair is in a high bun. I'm at home today in my dining room, flanked by images from the National African American History Museum, such as a copy of the Emancipation Proclamation and great DEI champions like Dr. Martin Luther King and W.E.B. Du Bois. I've been asked to offer some remarks on the theme of today's event, achieving liberty and justice for all people with disabilities through social justice and racial equity. And I love that because it really talks about, as Dr. Knackstedt mentioned, the intersectionality of these topics. But I'd like to specifically touch on the state level actions Virginia has begun to develop more meaningful disability rights and policies. Just as we know, the historic structures of oppression were designed to create supremacy and sustain enslavement and exclude communities of color and women and segregate people with disabilities. We also know that these structures were never erased and have only evolved. Today, while we have made important strides through the ADA, the Olmstead decision of 1999, and even the Virginians with Disability Act of 1985, which prohibits employment discrimination against individuals with a disability, there still exists endemically throughout our systems cunning and insidious, and I would even say easily overlooked forms of exclusion. And instead, inequity and injustice are protected or insulated by those who desire to overlook the way structures of oppression are manifested and operationalized. And for that reason, we have to be vulnerable and honest about our structures, which is why this conversation today is so important. There are extensive systems that prevent the implementation of accessibility and inhibit the needed access to opportunities for persons with disabilities, especially persons with disabilities who intersect with other marginalized identities. In 2019, Governor Northam appointed me as Chief Diversity Officer, a secretary-level position, to help him and the Commonwealth intentionally think about ways equity should be threaded across all public and private sectors, our state workforce and beyond. In 2020, I created the Office of Diversity, Equity, and Inclusion, and we immediately got to work. In my tenure, this position and office have been codified for every future administration to really build upon the work that's already begun. And believe me, it will take generations to see measurable outcomes or dividends from what has been invested. But we have begun to see the fruit of our work. For example, we launched the first statewide strategic plan, the One Virginia Plan, which has become a model for other states. And Virginia won the best state twice in a row, unprecedented, for which to do business, due in part to our commitment to a diversity infrastructure. I urge you to visit our website, and you can do so by searching One Virginia on any search engine to learn more about our One Virginia mission, or by visiting the various links that may be available in the chat. We want your feedback and thought on these documents. As I shared, Governor Northam wanted to have an honest and challenging conversation about the inequities faced by Virginians with disabilities and all marginalized communities. And as many of you know, 2019 was really a beginning of a racial reckoning in Virginia, even before we experienced the 21st century lynching or murder of George Floyd in 2020. So in 2020, Governor Northam signed Executive Order 47 and Executive Directive 6, which dramatically expanded the scope of support for individuals with disabilities in higher education, employment, and state services. And importantly, EO 47 led to disability protections being added to the Virginia Human Rights Act in 2021. And I see my colleague, Mona Siddiqui, on the call, one of our deputy diversity officers, who was really a champion for this work. As we reflect today on the intersection between race, ethnicity, and disability, and as we work to shape the future of disability policy, here are a few leadership nuggets I've learned over 20 years as a science teacher for students with disabilities. So I like to elbow bump you, Kim, because I think we have that in common. And now in this role that I'm in as an advocate for all, this is what I've learned. Despite being marginalized, our presence at the table and in the room where it happens is essential to the transformation of the structures and barriers that perpetuate inequity. We have to use our presence meaningfully, though. This is extremely hard and taxing work. Many of you know I'm preaching to the choir. You all are change agents. So it requires us to be change agents and not always peacemakers. Change agents make change. And oftentimes peacemakers are known to sustain the status quo and not really overturn the apple carts. But real change agents have the emotional intelligence to do both. We can be change agents and we can be peacemakers. We know when we must disrupt and we know when we need to build consensus. But I want to make a really important point. As change agents fighting for disability policy and accessibility policies, we must resist the urge to tear other change agents down, because there's a role for all of us to play on the continuum for change and reform. But two, and here's a really great one, health inequity was glaringly clear before the COVID-19 outbreak, but even more evident as the COVID crisis revealed our structural inequities. Many of you on this call know that these weren't hidden from many of us. We kind of knew they were already there, but they became visible for others. The governor saw the need to acknowledge this, and my office worked with leaders across the state to stand up the first ever health equity working group as part of the COVID-19 Virginia Unified Command structure, which included very intentionally diverse disability advocates and champions so that all voices were represented. I want to give a shout out to our very own in state government, Karen Brim, who served as our accessibility advocate on that work group. Our charge was to thread equity in our COVID response with many folks who could not see that their processes and practices were for generations unfair and equitable. But I was resolute to be a change maker, but to do so with kindness and collegiality. So as I reflect on these two nuggets, I have to talk about House Joint Resolution 537, which, first state in the South, declared racism the larger public health crisis across several social determinants of health. This unprecedented declaration provides for the foundation of my office to serve as a change agent for the next 402 years. In reaction to this important declaration of racism as the larger public health crisis, we created two historic mechanisms that make inequity visible and less nebulous across social determinants of health. And quite candidly, in my mind, social determinants of health is just a fancy way of saying racism. And the mechanisms, while only a start, are two health equity dashboards that are commensurate with the social determinants of health that are listed in House Joint Resolution 537. And I'm hoping there will be a link in the chat for you to access that. At their core, these dashboards dispassionately measure the pervasive way racism is synthesized across those social determinants of health, 133 Virginia localities, and by race and ethnicity. And that's so important because I wanted us to move away from the conversation, does racism exist, to now what are we going to do about it? So first, our Equity in Action dashboard celebrates the COVID resources that we've allocated across the COVID-19 response through the CARES Act funding and American Rescue Plan funding. And the Equity at a Glance dashboard takes it a step further. You know, the Equity in Action dashboard shows us transparently, gives Virginia residents a look to see where our state government and local government officials are putting those dollars. That's unprecedented. But the Equity at a Glance dashboard, even more unprecedented, because it's now a call to action for our federal, state, and local policymakers to examine where the equity gaps are and then direct and invest future resources and solutions. Moving forward, we want to formulate equity dashboards that will underscore dispassionately the need for disability policies across our Commonwealth, but we need your support and input. How can we develop dashboards that create urgency and underscore the need for sustainable structural reform and the advancement of disability policy? Currently, the dashboards synthesize across 6 social determinants of health. Send me your ideas to advance these dashboards. What should we include that makes disability inequity visible? I really want to hear from you, so I'm going to ask that you reach out to my office with your ideas. My third nugget is that structural discrimination and inequity operationalizes and normalizes the forms of oppression that we interact with daily. So the Governor's Office of Diversity, Equity, and Inclusion are driven by the following premise, and I really want you to hear me. We have to accept that our systems are not broken. Right? We say that often. Rather, they are operating in the exact way they were intended to function, and that's inequitably. Structural inequity exists in all of our systems: government, law enforcement, education, housing, healthcare. Addressing these and speaking about discrimination doesn't make you divisive or racist. Pretending that these disparities don't exist, pretending that it's not relevant, that's the divisive part and the cruel part. We also have to understand that racism and the once legalized system of slavery make all other modern forms of oppression possible, whether it's the exclusion of people with disabilities, the LGBTQ plus community, communities of color, immigrant communities, or the aging community. All marginalized or underrepresented groups experience a level of oppression because structural racism was created to make most individuals and communities feel inferior and select individuals feel superior. So here's my call to action for you. First, we must hold our policy leaders, our business leaders, our government leaders, and I mean all of them, accountable for this important work. I urge you to support leaders who will advance this equity work in disability policy and not in the check the box kind of ways, and you know what I'm talking about. Secondly, this is really important, so get your pencils and tablets ready. In reaction to EO 47 that I mentioned earlier, and incredible members of our Virginia General Assembly, the governor's office is currently conducting a language access and equity study for Virginians with limited English proficiency and those with disabilities interacting with state government systems. As a component of this study, we are hosting a series of work groups with organizations and stakeholders focused on the inclusion of persons with disabilities and disability policy. If you have ideas, questions, or proposals, or you want to be a part of that work group, please reach out to me and my staff and join us. You can email me at DEIdirector@governor.virginia.gov, and I'm hoping that that will be in the chat for you. And as I've mentioned, please reach out to me and my staff with any questions or feedback that you have about the One Virginia Plan and our unprecedented equity dashboards. In closing, given the meaningful conversation that we just started with Kim and myself and Adrienne, we must commit to lift each other as we rise. Individually, let's break out of our silos, reject our egos, and resist pitting ourselves against each other so that we can help each other survive these toxic spaces. Collectively, all of us together, we have to acknowledge that inequity and inaccessibility have been so normalized that it's endemic. It's not something that lives in some abstract other place beyond the confines of our lives. It resides in every organization, on your team, maybe even next door to you, in our neighborhoods, grocery stores, schools, and all of our systems. So we must stop imagining DEI or DEIA as an ambiguous moral imperative. And instead, we need to think about DEI as tangible practices and policies that can inform and reform our daily operations to lead us to health equity and belonging for all. So efforts across government to advance policies in Virginia for inclusion, unfortunately, remain discretionary. Equity cannot thrive at the discretion of select persons in power. The fight for equity is long and must be systemic. So as one of my faves says, Shirley Chisholm, if they don't give you a seat at the table, bring a folding chair. And as Janice Underwood says, just kick down the door and welcome yourself to the table. So I'll turn it back over to you, Adrienne. Great to be with you.
Thank you, Dr. Underwood. And thank you for the reference of the chair and the table, because right now we're going to come together at this virtual table. We all have a chair and we're going to have a conversation. I do want to mention that all of the links that Dr. Underwood mentioned have been placed into the chat, so you can retrieve those links and you can access the information that she said. And thank you to Dr. Knackstedt for the information that you provided at the national level. So now it's time for us to engage in conversation. I'm going to start first with Dr. Knackstedt. And the question for you, Dr. Knackstedt, is what is the most pressing issue that the current administration is trying to resolve relating to people with disabilities?
Absolutely. Thank you for that question. I think, when thinking about this question, there are so many issues we can tackle. I think one of the sayings we've been using in the administration is we're trying not to boil the ocean, and we are there are so many issues to tackle. I think one of the things that is of deep concern to us and working with the agencies is we obviously have COVID, and I want to talk about that and what that means to the disability community. But thinking broadly is the economic security and economic self-sufficiency for people with disabilities. When we did a big celebration of the Americans with Disabilities Act at the White House in July, and we all the agencies came together and we released significant cross-agency guidance at that time. I think one of the issues when we were doing some interagency work, when we were talking through, is what are we really doing to advance employment? How are we working together and thinking about women with disabilities, women of color with disabilities? How are we thinking of, again, these, as Dr. Underwood and I have just talked about, really the intersectional nature of these policies, and how are we advancing really employment policies for people with disabilities? I think the issues of subminimum wage for people with disabilities, thinking about how are we moving forward with, again, more than just a merely compliance framework, but a culture of inclusivity in the workplace. We have, even pre-COVID, an unemployment rate for people with disabilities that is stagnant and extreme and high. And so I think these are the issues that we are really trying to dig into. And I think it's part of this overall framework of how we actually think about advancing disability policy in a meaningful way. And so we have a lot of interagency work we're trying to tackle. I do want to think about COVID, because that's really critical to health equity. And again, this is not an issue that's just when we're thinking in silos. I think this is one of the issues we think about, just a person with a disability, and we forget that person has other identities, right? Again, we're really trying to tackle these issues from an intersectional nature, but that's not how we collect data oftentimes. The ability to kind of, and not to get wonky, but cross-tabulate our data is challenging. And so it's really hard to oftentimes think on a macro level about how how COVID has actually impacted the lives of everyone when we don't collect data in that way. And so, talking to everyone and hearing the stories helps us kind of develop a frame for this. But COVID has really changed the landscape and brought to light issues that we know have been a problem for decades, and raised the inequities that we knew were there, but I think has shed a light on it in a really meaningful way. We also have the issue of long haul COVID, and that is forever. It is one of the biggest health crises I think we have moving forward, and is really impactful. We have people with very significant healthcare needs that are going to be needing support moving forward, and yet we don't really have a great definition and an understanding from a clinical sense of what long COVID means. So we have a lot to tackle, but I think these are all intersecting as well. So I think those are just a few to comment on.
Thank you, Dr. Knackstedt. I am going to have a follow-up question if we have time, so I'll come back to that. Your comments have prompted some questions in the chat. I want the audience to know that I will come to those questions. First, I'm going to ask Dr. Underwood if you have any reaction to what Dr. Knackstedt said before I ask you your first question.
Well, I joined Dr. Knackstedt in this idea that we have to look at these issues from an intersectionality standpoint. That's exactly what we're trying to do here in Virginia, because we're not just one thing, right? It's like, I am a Black woman who identifies with she and her. I'm a mother. I'm an educator. I'm a first generation college student. I'm all of these things that make me who I am. And so we've got to stop thinking about people with disabilities as just that is their only identity, because we intersect with so many things. So I join you in that. And then the other thing I'll just mention is that in Virginia, we really want to, and I think the most pressing thing in Virginia is increasing people with disabilities in our state workforce. Our numbers are so abysmal, and probably we need to start with the fact that there are so many people with disabilities who have reached out to me that said, hey, I do have a disability. I'm part of the state workforce, but I don't feel comfortable self-disclosing. And that is a separate and distinct problem and issue that is so connected to the overall issue. What do we need to do for culture change in our state agencies and our federal agencies to make people feel comfortable to even self-disclose and perhaps request that accommodation that they need to be successful in that role? So there's such a culture of intimidation in our workforce, and we've got to deal with that more macro problem. And that's something that's really important to me, not only as a former special education teacher, but that's just who I know. I can tell you who the Underwoods are. My husband works with people with autism and behavior challenges, and we are always faced with parents and community members that come up to us and say, you know, my child has a disability and they don't feel comfortable, or I have a disability and I don't feel comfortable disclosing it, or I don't want to talk about it because I don't want to be retaliated against or put in a box.
Yeah, thank you. Thank you for that. I can dive deeper into that. Those who know me know that I actually just came from working with an agency with people with intellectual disabilities, and our intersection was around employment. And so I'm sure there's some questions that will come up with about that. I am going to ask you a separate question. So I'm going to change gears a little bit. And so the first question that I have for you, Dr. Underwood.
Yes, I'm ready.
I know you've been doing incredible work in the DEIA space in Virginia. How do we connect the dots in what you are doing in Virginia on a national level that intersects racial equity and disability rights?
Thank you for that question. Well, let me just say, events like this connect state leaders like myself with federal partners like Kim, and so we need to keep the conversation going. We need to, as I mentioned in my earlier remarks, break out of our silos, reject our egos, and like get to work, roll up our sleeves. I was telling Kim earlier, as we were chatting before this session, that, you know, work at the federal level gives me, you know, a level of support and comfort at the state level. And I provide support and cover for those at the local level, right? Or those who are doing the work in state agencies, even in local government or school districts here in Virginia. But also the One Virginia plan is a model for other states. And for the federal government, even as the federal government is thinking about creating that strategic plan. I'm hoping that we can work together, sort of link elbows and really build diversity-led innovation. The equity dashboards are another example, right? They're meant to be an umbrella for all state agencies to link the work that we're doing with accountability. So I want these dashboards to grow. And I want all states, I want the federal government to also make these metrics at the federal level across all states more visible for everyone to consume. I want to share with you something really exciting that's about to happen with these equity dashboards. I didn't mention in my remarks, but the Equity at a Glance dashboard will now include a workforce metric that will make our lack of diversity in our state workforce visible. Right? We will be including not only classified employees, but appointed gubernatorial appointments across race, ethnicity, gender, and disability status. And I can tell you from looking at them, we have a lot of work to do. But the first sort of step as a former science teacher, we've got to state the problem. We've got to make it visible. I want everyone to see the numbers so that it holds our policymakers and our state agencies accountable to do something about it. So please take a look at those equity dashboards, and just know as of October, you will hopefully see, if we can keep funding, we want to make these equity dashboards include metrics with the disability community in terms of our state workforce. That can provide a model for perhaps the federal government to do the same and other states to do the same.
Thank you. Thank you for that. I'm not on mute. I gotta keep checking to make sure I'm not on mute. Dr. Knackstedt, before I ask you your next question, I want to ask you, do you have any reaction to what Dr. Underwood just said about some of the things that she is referring to at the state level?
Yeah, I think that point about data and kind of stating the problem is so important. You know, federal government is a massive employer in this country, and oftentimes we do share data, but it's not always in a way that is easy to access. And so even when we think about you know, how we are you know, stating the problem, often it's not in a way that actually is really out there and publicly available. And so I think, you know, with this DEIA executive order, this is really one of the first times we've actually said we're going to have a plan for this. We're going to then agencies are going to have a plan, and again we're having a data-driven approach. So just as Virginia is going through this process, it's really it's kind of picking up where the Obama administration left off in some of this work for us, and thinking about like the next steps of how we move it forward. And it's very much, you know, we may not be where we want to be right in this moment, but we're gonna name it, and then we're gonna work to improve it. And so it's sort of the parallel process that we have going on, and it's exciting. It's, you know, it's exciting work, but there's a lot to get done. So
thank you for that. I know that we have limited time, so I know that right now we're talking maybe about another 20 minutes before we're going to have to wrap up and end our session. Dr. Knackstedt, you mentioned the Obama administration, but I would like to ask you a question about how is this current administration? What can we expect differently between this current administration's approach when it comes to meeting the needs of people with disabilities and the immediate past administration?
Yeah, absolutely. You know, I think one of the things I want to mention is we have people with disabilities, people with chronic conditions in positions that are appointments. So, for instance, I'm immunocompromised. I have chronic conditions, and that's something that I name and I talk about, and that gives me a perspective when working on these policies. Many of my colleagues talk about that too. I often post on Twitter when I'm doing one of my infusions on every other Friday, and it's, you know, it's something that I think is important to, you know, talking about self-identification. It's about anyone can be in these positions, and that's really important to talk about. And it is scary. It's like, will I get what I need and be supported when I'm having a rough day? And yes, absolutely. And so I think that's really critical. And so really thinking about how presidential appointees are talking about, you know, that they have disabilities and that they're in positions and that they are part of the work, and also really bringing that perspective, I think is a really important and also unique part of this administration. I think also our openness to working with the community is unique. We try to have as much as we can an open door. My colleagues in the Office of Public Engagement are holding listening sessions and making sure that that is translated to the policy work that we're doing. It's different. It can't be in person right now, which is unfortunate, but virtual as much as possible. We want to know what the problems are. We want to own what those are, and then we want to build on them to make sure our policies include. And I think also just, you know, my role is new for all administrations. We actually are making this really critical, but people with disabilities are at the table. I mean, I think that, you know, what Dr. Underwood said about, you know, you get right at the table and you kick down that door. That is sort of what we're doing. We are making the White House more accessible. We are making policies more accessible, like disability is back in the White House, and we are making sure that's known.
Thank you so much. Dr. Underwood, I'm going to have a similar question for you, but I do want to give a heads up to Dr. Knackstedt that I am going to go to the chat for your next question. I know you can't see the chat. And so I want you to know that the question I'm going to ask you after Dr. Underwood is on what is the update on sub-minimum wage and sheltered workshops in this? Is this a priority for President Biden? So that will be the question I come back to.
I love that question. I cannot wait to answer.
Too. And so, Dr. Underwood, my question for you is, have you and your team worked, how has you and your team worked towards centering and empowering marginalized communities in your equity work that you're doing for the Commonwealth of Virginia?
Well, I love that question, and I can share a bit and then welcome people to join me. One of the things I did mention was we are holding stakeholder listening sessions in the same way that Dr. Knackstedt mentioned at the federal level. We've been doing that, since the beginning of COVID. But even before COVID started, Governor Northam had the clairvoyance to understand that, we had to have this challenging conversation. And so in 2019, when he appointed me, I started a listening tour and conversation tour, and we began to get input to develop the One Virginia plan so that as many voices could be part of creating that One Virginia plan. So we began to travel around and get people's input. And then we had to pivot to the virtual world in 2020. But we were still talking to lots of groups and individuals so that not only does the One Virginia plan sort of sit as a way to drive diversity-led innovation in just our daily operations, it really is meant to be a statewide strategy upon which you build diversity in our workforce to include people with disabilities, to include procurement with regard to the use of SWAM, businesses, language access is a big issue that we're holding, as I mentioned, those focus groups and work groups with communities. But the number one area is that we codified, we are the first state for which to do so, our COVID-19 health equity working group. And so for every future emergency declaration, there will be an equity working group. That's huge, which brings in so many community voices, and anyone can be a part of that equity working group. It gives unprecedented access to the everyday resident to government leaders and decision makers, such as myself and the director of the Virginia Department of Emergency Management and the governor's staff. And so we want to make sure that we build resiliency for the next pandemic, for the next hurricane, for the next emergency declaration. And that community engagement piece has now been codified as just, this is how we do business. If you're interested in joining the Health Equity Working Group, I also would invite you to send me an email to the email that's in my chat, or also you may even like to visit the Virginia Department of Emergency Management or even the Virginia Department of Health Office of Health Equity. Get involved, be a part of the conversation, and help us with the solutions.
Thank you for that. Thank you. And thank you for mentioning the One Virginia plan again. I do want to urge people to go out and look at that plan. You know that we at Virginia Housing use those tools to develop our strategic plan for DEI, and they were very helpful. But the great thing is that any organization can use those plans. So I do encourage people to go out and use those. And so I'm going to go back to you, Dr. Knackstedt. And so that question that we had about the sheltered work. So the question again for you is, what is the update on sub-minimum wage and sheltered workshops? And is this a priority for President Biden?
Yeah, absolutely. And again, really appreciate that question. Didn't include it in my opening remarks. So I had a feeling it might come up in the conversation, knowing this group. So to answer the last part of that question first, and then working my way back. Yes, actually phasing out 14C of the Fair Labor Standards Act or sub-minimum wage actually is a presidential commitment. And so that's part of the Build Back Better agenda for the president. So it was in what was originally called the American Jobs Plan. That was a commitment. It was actually a proposal in the American Rescue Plan, and then due to the procedures of the Senate, it was removed. It was reproposed in the American Jobs Plan, which has been, now we call it just the Build Back Better agenda due to all the different names of all these different plans. And so the proposal was to phase out sub-minimum wage, and with funding behind that. We know that this is best achieved when there's some funding to make this transformation happen. And so that funding to support workers with disabilities who are being paid a sub-minimum wage, really make that transition, and also the employers who are providing to make that transition of their business to be providing competitive integrated employment and transition those services to integrated day services. So that was the proposal. Again, given the rules of the Senate with reconciliation, we are seeing right now this sort of play out. For those of you that are closely following, what is occurring on the Hill right now. The House of Representatives is going through their process right now. We're waiting to see what happens in the Senate, but in the markup in the Committee on Education and Labor, with Chairman Bobby Scott, my former boss, they actually had a piece of their bill here that included a proposal that would fund phasing out 14C. It doesn't actually require national phase out due to, again, to these rules, but it would actually include funding, and then a contingent on if a state would want that funding, then they would be required to statewide phase out 14C or sub-minimum wage. So a little incentive to get to kind of make this process get moving, and then statewide would need to go through the process. So we also just saw California pass a bill, and it's sitting on the governor's desk, and we've seen a number of other states this year move that along. So this would kind of help those states that are really ready to make that transition, and then later on down the road, we would see if Congress is ready to actually amend the Fair Labor Standards Act. So we are seeing this move forward, and moving forward on the president's priority here. So I hope that's a helpful, some helpful context of where things are at right now.
Absolutely. I'm just following up with that. As we see 14C move forward, will that also mean that we will see sheltered workshops go away, in addition to the sub-minimum wage?
Yeah, so part of this proposal that again is in the House's reconciliation text, we're waiting on the Senate, is to move forward with competitive integrated employment. So it really is, it has that integrated piece. It's not just the wages. So it's really looking at that full transformation of the employment. But that money, again, would be statewide, and then the state would decide on how to best support each of their employers and employees with disabilities. And so looking at that full funding, and it does set up an advisory committee for the state on how to best use that funding.
Thank you. Thank you for that.
Yeah.
And Dr. Underwood, what I'm going to do is I'm going to make sure we get to a question in the chat for you too. And so this question for you comes from the chat, and it is, does the governor have a plan to increase employment of people with disabilities in state government?
I really love that question, and it needs to be the priority of all governors. It should have been the priority of governors of all past and governors of all future. So whoever our governor will be in Virginia, Governor 74, needs to be their priority as well. I want to speak specifically about Governor Northam. It's been his priority, which is why we saw EO 47, which was the most robust set of broad protections for people with disabilities to really increase employment in our state agencies. But we still see that we are still limited by the feelings of many of our state employees who have shared they just don't feel comfortable disclosing this. And so what we've done in our plan has not only been to change many options and many parts of our state application to make them more accessible. That was step one. But step two is really to launch and drive the One Virginia plan to hold our state agencies accountable. And it's going to take time. I kind of see the One Virginia plan as the seed in the ground. And so now it's really up to us to water it and protect it from predators so that it can really blossom and grow and yield the fruit that we hope for it to see. These inequities started 402 years ago. And so it's going to take some time, as Dr. Knackstedt mentioned, that so that we can see those dividends pay. We're starting to see those dividends pay just by the mere fact that we now have a Biden administration that is open and welcoming and amenable to a lot of these issues in historic and unprecedented ways. So now we can begin to allow something like the One Virginia plan to fall on good fertile soil so that those seeds can blossom. So I would say the One Virginia plan, we've changed our state employment application. So please, I welcome those with disabilities to check out the ways we've changed our employment application process so that it is more accessible, and welcome everyone to download that One Virginia toolkit.
Yeah, and Dr. Underwood, I would suspect that not only would that be employment on the with jobs with the Commonwealth, but also opportunities that come through procurement opportunities with the Commonwealth as well with people with disabilities. Would that be true?
Not only is it true, Governor Northam actually set a 42% procurement goal for all state agencies to procure with women and minority businesses and all those, and also those disability or those businesses owned by those with disabilities and those disabled veterans. So we are really moving in the right direction. It's just now we need to keep the direction headed. We need to head in the direction, stay the course, because we are showing the return on investment for these inclusive policies.
Absolutely. Well, I'm checking out the time. Thank you so much to both of you. We just have a couple of minutes left, so I am going to give you both just a couple of minutes to have any closing remarks, anything that you wish you had an opportunity or a question that you wish that I had asked. So I'll start with you, Dr. Knackstedt.
Great. Thank you so much. I think the biggest thing I just want to say is just how much I appreciate all of the work that everyone on this call and listening in on the live stream, all the work that you all do. We really couldn't do our work in the administration without you. It is really, your voice and you elevating these issues and really the implementation of the policies on the ground that allow us to be effective in our jobs. So, I hope to continue the conversation with all of you, and it's events like this that really make it worthwhile, and knowing that what we're doing hopefully is having an impact to really advance the lives of people with disabilities every day. So just thank you for this opportunity to talk with you.
Thank you. Thank you so much. And you, Dr. Underwood.
Thank you, Adrienne, for the invitation and serving as an amazing moderator. This was incredible, and it's been an honor to be on the virtual stage with Dr. Knackstedt and with all of you as she shared. The one thing that I want to share that probably I didn't get to share is that we need to think about these reforms and all the work that you all are doing and really build them in our system. So for example, I saw a question in the chat we didn't get a chance to get to about protecting students with disabilities from discrimination in our local schools. I have to tell you that having come from the local schools, this is such a big issue, and it's not an issue which is for one easily answered, but it does require like a menu of options. And that is exactly what inequity is going to require, a menu of options. It's not just, hey, we need to fire so-and-so who works at the VDOE. We need to reform our teacher preparation programs. We need to really create a pipeline of solutions, right? That start even changing the culture of our American schooling for those who are in school right now, right? Who are consumers, and parents who are consumers of public education. So it does require a myriad or a menu of solutions, and it's not just going to take one or two. It's going to be a long menu, because this kind of thing should not be discretionary for just like one person in power. This is not something just for President Biden and Vice President Harris or just for Governor Northam. This is for all of us. We all need to be a part of that menu of solutions. And so for that reason, I really want to underscore this idea of reaching out to, I know my office at the DEI director at governor.virginia.gov email that was placed in the chat. We want you to be a part of our health equity working group to exist for all future emergency declarations, because we know that people with disabilities struggled during the early days of COVID and still do. We want to provide access and accessibility for all, and we need you at the table. So please do be a part of our conversations and our community engagement. And also, please do reach out to us. We want you to, many of you on the call, to be a part of our disability work groups and focus groups that will lead to increased access to state services for people with disabilities. We're doing the work, we're rolling up our sleeves, and we need you.
Thank you. Thank you. Thank you both. We did manage to wrap up right in time, so I'm glad for that. Maybe they'll invite me back. But before I turn it back over to the host, I just want to thank you both again for just a great, great conversation and great information and resources. I do see that we have several questions that we had in the chat that we didn't get a chance to ask. So I'm going to put the host on the spot and ask that perhaps they can capture all of those great questions so we can continue this conversation. Thank you again, and I send it back over to our host.